Live, the morning show from CBS Local 2, where local comes first.
Well, apparently some people can be a little bit hesitant to go under the knife to improve their looks. There are concerns about sedation. But in studio this morning is Dr. Timothy Joshin from Contour Dermatology here in the Valley. He says now there are apparently some new options that people should not be too concerned about. And can we speak with Dr. Joshin now? He is standing by. There you are, Dr. Joshin. Can you hear me okay?
I sure can.
And your sound sounds okay as well. That's the good news here this morning. Let's talk about some of the concerns that prospective patients might have about sedation. What are the concerns that are out there, and why are those concerns there?
Well, a lot of people have concerns about the risks of having general anesthesia. And the risks are there for having cosmetic surgery, as we all know, like Donde West died, and now we have a law in place that we have to take special care for patients who are undergoing cosmetic surgery because people do have serious complications. Now, the good news is that when you have local anesthesia, which is what we do in a dermatology office, there have really been no reported deaths in a new survey that was done over a 10-year period out of Florida. And so it shows that doing local anesthesia can really greatly reduce your risk of having serious complications.
So, doctor, do you use local anesthesia when you're performing your procedures?
Yes, I do. In my office, we do the technique called tumescent anesthesia. And what that is it's a water-based solution that has a little bit of lidocaine to numb up the area and a little bit of epinephrine to constrict the blood vessels. And that's a way we can do more aggressive procedures like liposuction, even facelifts, and we can do eyelid surgery, and we can also do hair transplants using this procedure. So it really minimizes the risk the patient has doing that type of procedure.
Now, I'm sorry, very quickly I wanted to ask you, you mentioned epinephrine, but doesn't that come with some allergens as well? How do you test for that with patients when they're doing it locally?
Well, typically people do not have an allergy to epinephrine. Now, some people will say that they have an allergy to epinephrine, but what it really means is that they are sensitive to it, because epinephrine will make your heart race and give you a panicky flight or fright kind of response. And so we want to, if people say that they have that sensitivity, what we'll do is we'll either try to avoid using it when we're using our anesthesia, or we'll send them to an allergist, and then they can make that determination whether they're really allergic to that ingredient or not.
Okay. How is it that people do have concerns about, going under today, being sedated? What do you think has kind of contributed to those concerns?
I think what we've heard is the cases where people die from having like a tummy tuck or a facelift or having liposuction. But the nice thing is when you do that procedure under local anesthesia over this 10-year period of time, there were no reported cases of death using the tumescent technique for liposuction. And it was actually the same for all procedures. There were no reported deaths using local anesthesia or this technique called tumescent anesthesia. And that technique was developed by a dermatologist, and it really has made aggressive procedures more safe and less risky for our patients.
What's your advice to people that are considering having some form of surgery done that would be, should they investigate themselves? Should they talk with their doctors? I mean, what do you prefer in a patient coming to you?
Well, I think people should do their homework. You want to interview the doctors that you're interested in having the procedure with and ask them about their complications and complication risk. And, it's all online now, so if you have really concerns, you can go online and find out what different surgeons, complication rate has been.
Okay, Valley dermatologist Dr. Timothy Joshin, thanks a lot for joining us this morning. It's good to see you as usual.
Yes,
Thank you very much.
All right. Thanks, Tim.